It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone, and welcome again. To another live round of Katz's Corner here on WABC Radio in New York. Had a little problem there, Mike, with the mic, but things seem to be okay. Good morning, everyone. This is Dr. Aaron Katz, and you're waking up to Katz's Corner. We're live at 1-800-848-WABC. That's 1-800-848-9222. And if you have a question about your health under the belt, you can give me a call on this rather chilly Sunday morning. It's been brutally cold here in New York. I hope that you're all staying warm, staying healthy, eating healthy. And I'm here for you if you'd like to give me a call about prostate issues. I'm happy to say that I'm about to celebrate my 1-year anniversary at Winthrop University Hospital next week. Started February of 2012. It's been going great. We have a wonderful institution. I love the administration, the hospital, my colleagues there, and have a terrific support team of nurses, medical assistants, physician's assistants. I want to thank them all for this past year in helping me transition over from Columbia to Winthrop, and I'm very happy there. Terrific team, and the patients, more importantly, I think most importantly, have been extremely happy with the care and the facility that we have there. My robotic colleagues, Dr. Gershbaum, Dr. Joe Jamal, Dr. Lou Fiella, my radiation oncology colleague, Dr. Jonathan Haas, who runs the CyberKnife, really outstanding physicians, all of them, and there to give you the best care and treatment if treatment is needed for both benign prostate conditions, urinary symptoms, and prostate cancer. And we have a cryotherapy program. As many of you know, if you listen to Katz's Corner, this is an area of expertise that I'm most interested in. Freezing the prostate for prostate cancer. Do about five or six of these now a week for men with early stage prostate cancer, where the cancer is just localized to one small area, and we can freeze that cancer without radiation or surgery, or in those patients where the cancer has returned. And, of course, the holistic program. We have the holistic urology program at Winthrop now, where men are on protocols with diet, herbal compounds, vitamins. We measure their vitamin D level, their C-reactive protein levels, which is a measurement of inflammation. We monitor their testosterone levels, which has been a big, an important factor for many men now who feel that their energy level, their sex drive is just not there and require a testosterone replacement. And we do that at Winthrop. We do that even with men with prostate cancer, and some of the recent studies have shown that it is relatively safe. It has to be done, obviously, under the supervision of a physician, of a urologist, because, the PSA values can fluctuate. They can go up, especially if you do have an elevated PSA or have prostate cancer. So if you need testosterone, and a lot of guys come to me and say, Dr. Katz, I really need testosterone. God, I'm feeling awful. I'm low on energy. I'm depressed. I just don't have that drive anymore. And, sometimes we do the testosterone levels, and they're in the tank. They're low, under 200. And, yes, you do need testosterone. But, there may be other medical conditions that are going on, or emotional factors, anxiety factors that can go on, too, that may also give you the same feelings, and your testosterone may actually be normal, and you don't need testosterone. You don't need to go and listen to these advertisements on the radio every week about how you can restore your testosterone if you just take this pill or that pill. That's nonsense, okay, and it's dangerous. And men need to know that if you take these things, they may have a negative effect on you. You know, your testicles are not going to produce testosterone. You know, your testicles may shrink up. You know, the shrinkage from Seinfeld. It's real, beyond just the cold temperatures. Well, I look over to the phones. We've got a few phone calls. I'm here alone. Dr. Cheetham is down in sunny, warm Bahamas, learning about HIFU, the newest form of prostate cancer therapy. Not available yet in the United States, but will be coming, I think, very shortly. And she's down there to learn with one of our friends, Dr. Steve Cianti, who's really done a lot of these HIFUs. We're running a HIFU program at Winthrop in a clinical trial now for men that have had recurrent cancer after radiation. And that is available, and you don't have to pay for that. It's free. It's a clinical trial sponsored by U.S. HIFU. But if you're considering about having HIFU right now, which is the heat wave therapy using ultrasound, it's not available in the U.S. If you've never been treated before, let's say you just have prostate cancer and you don't want radiation, you don't want surgery, and you're looking for another option, well, you can check out U.S. HIFU, and you need to go to the Bahamas, Bermuda, or somewhere down in the Dominican Republic. But it is rather expensive, I will tell you. But Dr. Cheetham's down there now, and she's learning the technique. So when it becomes FDA approved, hopefully maybe by the end of this year, we'll have that also available for you at Winthrop University Hospital. That's winthrop.org. Let's go to the phones, guys. Let's hear from Don in New Jersey. Good morning, Don.
Morning, doctor. How are you?
How are you doing today?
Okay. Yeah, question. 9 years back, I developed prostate cancer. Okay, I had a Gleason 7, 4 and a 3. I did IMRT. Okay, I did all of those treatments, and then we just watched it. So like 9.5 years later, my PSA is 1.4. Okay, after the 9 years or so. And Dre, the other day, he did a digital the other day, and he said he felt a little something.
Okay.
So obviously he wants to do, a biopsy.
Right. Well, first of all, IMRT, which is a form of radiation therapy, it's usually 45 days of radiation treatment. And that can take your PSA down to around 1. Now, you're out 9 years from that, and your PSA of 1.4.
It went as low as 0.4.
Yeah, but now it's 1.4. I'll tell you one thing, Don. I think you've done very well, very, very well to have a 1.4. The question about the change in and rectal exam, well, that's why we tell people if you're going to be screened, it doesn't just rely on the PSA alone. It relies on both the digital exam and the PSA. So now you have an excellent PSA, 1.4 at 9 years after radiation, but a change in rectal exam. This is the same doctor you've been going to?
Yes.
And he felt your prostate every 3, 4 months, 6 months, whatever?
Yeah.
And so he feels there's something there. Well, just because he feels something there doesn't mean it's cancer, even though you've had cancer. It could be just a benign nodule, okay? It could be BPH. Okay. So he's probably going to be conservative and say, hey, you know what, Don, let's do a biopsy and see. If, and there are risks of a biopsy, as you well know. There can be some blood in the urine. That you should get a urine test to make sure you don't have an infection. You should be put on antibiotics. The risk of infection right now, Don, in good hands is probably less than probably 3%, 2% even. It's pretty low.
Okay.
So if you're concerned, and how old are you? Did you say?
62.
62. So you had radiation at a young age, didn't you?
Yeah.
And you didn't want to have any other treatment, surgery, or anything like that at that point, huh?
No, I just decided to go with that.
Okay. One thing, if you didn't, I think it's reasonable to do the biopsy. First of all, you're out a lot of years. Let's just make sure you don't have cancer. You're going to be walking around now. You're going to be anxious. You're anxious. Oh my God, this doctor's telling me I have a change in my prostate. What's going on? Do I have cancer? Does it come back? Blah blah blah. Might be I think it'd be reasonable to do a biopsy.
Okay.
The other, if you said no, I don't want a biopsy. Absolutely not. The only thing I would do is probably get an MRI. And you know what? You could get an MRI even before you did the biopsy, just to help the doctor localize and see if there's something in the prostate beyond the nodule that may be there. Because once you do the biopsy, then you get inflammation, and it may skew the MRI and make it difficult to read. So you could say to your doctor, look, I'm out 9 years. There's no urgency. What do you think? We get an MRI first, and then, and then I'll go for the biopsy. But let's just see what the prostate looks like.
And the MRI can do that for me then?
Yeah, you need a 3 Tesla MRI. You live in New Jersey. I'm sure there's a couple of great centers out there that can do that. A 3T MRI.
Okay.
And you tell your urologist. I'm sure he knows about it. And I would do that. And then I think I would proceed with the biopsy. Change in nodule. You're out so many years. You're a relatively young guy. You're otherwise healthy, Don?
Yeah.
I would. That's how I would play it.
All right, very good, Doc.
Okay, hope that was helpful. Thanks for tuning in.
Thank you.
Okay, and if you're into the tennis, by the way, outstanding match going on between Djokovic and Andy Murray right here. They're in the looks like they're in the fourth set with Djokovic up 2-1, and looks like he's now 4-1 in the fourth, so he could be taking it. Looks like Andy Murray had a little, a little muscle spasm there. There's my sports commenting for the morning. Anyway, let's go to Roy in Montclair. And by the way, if you're listening to the show and waking up here with me at 7:13 in the morning, Dr. Aaron Katz here on WABC Radio. If you have a question, you can call me at 1-800-848-9222. That's 1-800-848-9222. Roy, good morning.
Good morning, doctor. Do you ever recommend prostate massage for keeping your prostate healthy?
Well, not just – the answer is yes. I have done a lot of prostate massages for guys because there are a subset of men. I can think of a number of them right off the top of my head that come in that are extremely benefited by the massage because of a condition called chronic prostatitis. I don't just do a massage just to say, hey, you know what, let's keep your prostate healthy, we'll massage you. No, that's not what it's about. But if you do have this condition where you have this chronic inflammation, chronic pelvic pain, urinary frequency, urgency, and discomfort, almost like a sensitivity. Like some guys describe it as like a golf ball down below my scrotum. I have this, when I sit, it hurts. All day it hurts. And they come in once a week and we do a prostate massage. And, it can be helpful in a subset of men. Is that your condition, or are you just...
No, I'm 68, and I have a healthy prostate. I'm just trying to stay that way, and it just made sense to me that to stimulate blood flow and kind of maybe press out any toxins that are there, and drain the prostate. That's all. I'm not a doctor. I was just thinking logically.
Well, think about this: sex. Okay, sex will drain the prostate. And sex will keep your prostate healthy, and will stimulate blood flow. And aerobic exercise will stimulate blood flow. And eating more fresh vegetables and less fats will improve blood flow. But it's about exercise, diet, and sexual activity, and that's really what would be helpful for your prostate. I wouldn't be manipulating myself. I wouldn't. Some guys come in like they bought something off the internet to self-stimulate themselves for this condition. I would have a doctor do it. I wouldn't do that though, Roy.
Okay. Thanks, doctor.
Yeah, sure. There's lots of ways to keep the prostate healthy. I think diet is important. I think exercise is important. I do recommend a number of herbal compounds that have things like saw palmetto, stinging nettles, Pygeum africanum. These things, cruciferous vegetables. There's a product called DIM that we use in our protocols. These are the things I think that can be very helpful. Vitamin D supplementation has been shown to be very helpful for the prostate in reducing inflammation. And then there are some herbals that can help in reducing inflammation and keeping the prostate healthy. Curcumin, ginger, green tea, scutellaria, holy basil. All of these wonderful herbs that I recommend to my patients on a weekly basis. But I wouldn't be, routinely massaging my prostate. Rudy in Trenton, New Jersey. Good morning. How are you, sir?
Fine, thank you.
Okay, what's on your mind today?
I went to see my urologist, and my pH was 2.4, and it went to, I think, 2.5 in around 11 months, and he suggests me getting a biopsy. But I've listened to you, and I think I need a second opinion, because it says it rises too quick in one hair.
Okay, how old are you, Rudy?
I'm 71.
All right. Well, there's a lot of reasons, if you listen to Katz's Corner every week, why your PSA can go up. I mean, you went from a 2.4 to a 3.5.
Yeah.
Now, a 3.5, Rudy, at your age, you know what? That's normal. Normal. Okay? So, it went up a little bit. But, if your prostate went up a little bit in size, so I would probably do an ultrasound of your prostate. How's the urinating going? Any problems with that?
No.
Oh, that's good. Any other medical problems at all?
I'm type 2 diabetic.
Okay. And what about your family? Anyone in your family have prostate cancer?
Not that I know of.
Right. Well, look, I would first examine you before you go ahead and stick needles in your prostate. I would probably do an ultrasound and calculate what's called your PSA density, which is your PSA divided by the volume, because you may have a big prostate and it could be totally normal for you, and I wouldn't recommend a biopsy. Just because it went up a little bit, one point in time, remember this if you're listening, one PSA in time means nothing, okay? It's got to be repeated. It should be followed. And for your age, Rudy, you're giving me, in fact, your PSA is, you're almost like a 60-year-old. I mean, it's actually a pretty good PSA.
Can I come to New York and see, or do you have anybody in New Jersey you could recommend me to?
Well, you can come to me. You can come see me in New York City, sure. There are some wonderful doctors in New Jersey, but it's hard for me to, and Trenton, I'm not sure I see you from Trenton. I'm not so sure some guys down there. There's some very good doctors in New Jersey, or you can come up. We have an office in Manhattan.
Okay.
You could also see, and thanks for your phone call, Rudy. And if you have a phone call out there and you'd like to give me a call, it's 1-800-848-9222. Again, that's 1-800-848-WABC. That's 1-800-848-9222. We have an office in Manhattan on Park Avenue, and Dr. Cheetham, who has just joined the practice at Winthrop, is also there. She's there on Mondays and Tuesdays, and I'm there on Fridays. And we also have a center now in Manhattan, as well as at Winthrop, where we perform these procedures called the green light. And a lot of guys, I did a couple this week, did very, very well. Patients that I do these green light lasers, and this is not a cancer therapy. This is a therapy for guys that are getting up a lot at night, that are having low urinary stream, that are really bothered by their urinary symptoms, that have been on, my herbal program, then the medication, and the medication is still, and the herbs are still not working enough. See, that's why I consider myself an integrative guy. I'm not just a holistic guy. People say, "Oh, Dr. Katz, I want to see you. You're a holistic doctor." I'm not a holistic. I'm integrative, and I do use a lot of herbs. And I think that for some guys with low urinary symptoms, herbs are great. And then there's some guys that can't urinate well, or we do an ultrasound of their bladder, and they're still like in mild retention. They need medication. And some patients, they take the medication. Like I'm thinking of a patient I just did the green light this week, and he's been on the medication for about 6 years, and he said, "You know what? I'm kind of done with the medication. It's really not helping me anymore. I just, what about this procedure, this green light?" So I do the green lights both at Winthrop, and we have a center here in Manhattan. It takes about 20 minutes, and it really kind of fixes the problem, where you just laser out this prostate tissue that's growing into the urethra. It can be done in about 20 minutes. It's covered by insurance. You go home, no hospitalization, and then you don't need the medication. And then, it really has changed a lot of guys' lives. It really has. I see patients that come back every week. Dr. Katz, I can't believe this procedure. I can't believe how quick it was, how well I'm doing, and it really did change my life. I can go to the movies now. I can see a show. I can travel on a plane without worrying. I can walk through the city without wondering where the next bathroom is. And if you walk through New York City, and it's not that easy to find a bathroom sometimes. The restaurants, they don't let you use it unless you're a customer. It's like almost you got to go through security to use a bathroom. Let's go back to James in Yonkers, New York. Good morning. How are you, sir?
Good morning, Doctor. I'm just listening to your show. I was leaving work, just happened to turn it on. I'm kind of wondering, I'm 51. I've never had a prostate exam. In the last few months, I've experienced like a loss of drive, just like you were describing that other guy, low energy, loss of sex drive. You think it's time for a prostate exam?
Well, yes, I do think. Yeah, I do think so. Listen, James, it's not a big deal to come to a urologist. You live in Yonkers, you could come to our office in Manhattan, or, if you wanted to speak to your internist about a local urologist to have a prostate exam, yes, as well as a PSA. I mean, the current recommendations by the AUA, the American Urological Association, has been reduced now. It's to get a PSA starting at the age of 40. It used to be 50. To get a PSA, just to get a baseline, check you out, do an exam, not a big deal. And then the question is, should you have a blood test for testosterone? Is your testosterone down? And it could be. I mean, that we see a lot of guys now where their testosterone is low, and you might need supplementation. You might need to have androgen replacement. And I think that this would be.
Should my normal doctor be testing for that when he takes blood or sees me?
I'm sorry?
Should he be telling me about my testosterone level during a normal blood test? It's not a routine thing, James. It's not like they're going to just do it. I think if you speak to him, though, and say, look, I've been feeling this way. I heard Dr. Katz on the radio, and he mentioned a testosterone. Can you do a level on me? I mean, there's no reason that they wouldn't do a level. But if I come see you, would you do that?
Of course I would do it. I mean, yeah. I mean, most urologists would do it because we do see there is this entity of this, condition. It's a real condition where guys need testosterone replacement. Now, you could be feeling low energy and low drive and low sexual drive for a lot of other reasons. It may not be testosterone. But, yeah, at 51, I think you should come in, you should have an exam, PSA, and testosterone. And then, then we can go from there,
I'm assuming you're in the book or
I'm in the book.
The internet?
I hope so. Can
I can make an appointment with you then?
Yes, you can make an appointment. You can call the office. It's 516-535-1900. And you can see me if I'm too, if you want to see me sooner, you can also see Dr. Cheetham. She's with me as well.
You work out of Manhattan?
Yeah, on Fridays we're in Manhattan on Park Avenue, and the rest of the week we're in Garden City in Long Island.
All right, Doc. Thank you. I'll be giving your office a call.
Thanks, James. Thanks for tuning in this morning. Let's hear from Steve in Saddlebrook, New Jersey. You had a surgery, Steve?
Yes, I just want to say you do a great show, Dr. Katz. I really enjoy it.
Oh, thank you, Steve. I appreciate that.
Okay. I spoke to your screener, and I said I had a radical prostatectomy 3 years ago. I had some erectile dysfunction before that, and both the doctors who did the biopsy and who did the surgery, who you both know, but I'm not going to name them, did a great job. And now, I'm totally impotent. I'm divorced, and I don't know if you've had any of the doctors that specialize in, sexual rehabilitation. I don't know the term for it. Have you had anybody on yet for that?
Steve, it's amazing you say that, because I was going to have one of our doctors this morning was going to be on, and he couldn't make it. He's going to be on March 3rd. His name is Brett Mellinger.
Okay.
Dr. Brett Mellinger, terrific doctor. He was actually the chairman of urology before I became chair a few years back, but he specializes in erectile dysfunction. I think for you, Steve, since you've been out 3 years from surgery, and how old are you, Steve?
I'm 63. I also,
Right.
Excuse me for interrupting. I also asked your screener. I'm out 3 years, and I've been going for PSA every year. Will I be doing that the rest of my life also? Those are the two questions, the erectile dysfunction, if you're going to have somebody, and also if this is going to be it the rest of my life, PSAs for the rest of my life.
Yeah. Well, for the rest of your life, maybe not. I think for the 10-year period, I think, yes, Steve, you need at least a PSA every 6 months. And then if your PSA is 0 or 10 years, you probably could stop doing PSAs. In terms of the erection problem, though, and I assume your PSA at this point is still 0?
Correct.
Okay, so you've been, I think you've been, what it sounds like, cured of prostate cancer, and now you're kind of dealing with some of the very common, and you're urinating okay, no leakage at all?
Very, very slightly.
Okay.
Okay, like just a couple of drops.
Okay, well, here's the thing, Steve. I think that you're probably going to need an injection program. Okay, and we can discuss this with Dr. Mellinger when he's on, or you can give him a call. But The oral agents, the Viagra, the Cialis, you've tried those already,
right? They don't work, and I'm sure you probably believe in this. After the radical prostatectomy, you take Viagra just as a rehabilitative thing to get whatever nerves you got left, keep them happy.
Yeah, it helps the blood flow, really.
Right.
But you know what? At 3 years now, Steve, if the medications aren't working, you need to step it up. And if you really want to re-engage in normal sexual function, you need to either A, start with an injection program. So this is a program where a doctor like Dr. Mellinger can teach you in the office to inject the penis with a medicine. It sounds kind of brutal and like, oh my God, how am I going to put a needle in my penis? But you know what? It's a very, very tiny needle, almost like a diabetic needle, and it goes into the side of the penis. You put it in, and in 2 minutes, Steve, you can have a normal-feeling, rigid erection. You hear these commercials for Viagra. If your erection lasts more than 4 hours, you got to go to the emergency room. That'll never happen with Viagra, but with these injections, you can have an erection that can last a long time. I know you're saying this
for the rest of the audience. I might as well name the two doctors because you know.
No, you don't have to.
I'm going to name them because they're both two very, very fine doctors. One is Michael Stifelman,
right,
and the other one is Herb Lepore, who you had on, a couple of months ago.
I know them well. They're excellent doctors.
So I know about that, and okay. So I wanted to ask you, and then one final question: if you could have a psychologist on, talking about men that are dating women and what point do you bring it up, etc. I know it's kind of a touchy subject. They can talk about it generally, but that would be something some men in my condition might be interested in also.
That's an excellent point, Steve. Very, very good point. Thank you for tuning in. When do you bring that up? You're meeting a woman and you're starting to, it's what direction it's going in. Are you going towards the bedroom? And the thing about the injection, though, Steve, and I know that you're off the line, is that it does give you some spontaneity, though. You can go right into the bathroom, pop the needle in, and then you can come back out, and then she could be like, whoa, somebody's ready. We have Dr. Cheetham on the line. In the last minute or two, she's calling in from the Bahamas. Philippa, are you there?
Good morning, Aaron. I certainly am, and I'm listening to the show from the Bahamas. It's absolutely fantastic, and thank you to the last caller for a great tip on organising a show on getting a psychologist on. Look forward to that.
Now, tell me, did you do any surgeries yesterday down there?
Yes, we did. I know that you thought that I'd come to the Bahamas just to lie on the beach in a bikini, but we've actually treated 6 men with prostate cancer down at the Doctors Hospital in Nassau. We did 2 cases on Friday, 2 cases yesterday, and we've got 2 cases scheduled today, and all the cases have gone very well. These are men who've come down from the New York area, from Boston. One gentleman came in from Colorado as well, and the gentlemen are staying in the hospital during the day. They're actually with us in the hotel just down the road from the hospital, and very, very successful procedures.
Well, I don't know if you can hear it, but that's the music in the background. Mike's putting on the music. So you're going to come back next weekend and you'll tell us all about it, Philippa. Safe travels. And thanks for that update. I think it's going to be a fantastic procedure, and I think this year, or maybe this year it'll get FDA approved, and we'll have it at Winthrop for you. Tune in every Sunday. Great show. This is Dr. Aaron Katz.